Welcome to Pod Operations Training Dispensing. This training will cover the positions and job duties of the staff and volunteers who will be working in the dispensing area. Please pay close attention to the information and instructions you are about to receive. At the end of this video, you'll be given additional instructions by your supervisor. Again, we thank you for your willingness to serve in this important public health response. As you may recall, dispensing is the third stage in the four-stage pod process. Here, the client will receive their medications and vaccinations and information sheets to take home with them. Let's find out a little more about the dispensing team and how it fits within the overall pod operation. Typically, the key position in dispensing is dispensing nurse. Depending on the scope of the incident and the size of the pod, there may be additional positions. As a member of the dispensing team, you will report directly to the medical supervisor. If you are a dispensing nurse, you will be dispensing medications or administering vaccine to the client and possibly to those who live in their home. Generally, only nurses and other medical professionals will be allowed to give vaccinations. However, in the event of a public health emergency, non-medical workers may be allowed to dispense medications. When the client arrives at your station, you will collect all of the pod forms, along with the medical form which lists each person in their household and what medications they are to be given. Ensure that the client understands the reasons why they are receiving vaccine or medication. For antibiotics and other oral medications, you will tear off the label tab that is attached to each medicine bottle or box. Affix this label to the form for each person you are dispensing medication for. If no label tab is available, you will need to write the lot number on the form. Once you have affixed the label or written the lot number on the form, you will hand the medications to the client along with the appropriate handouts and information sheets. As a final step, write the client's name on the medicine bottle or box, as well as any associated medication or information sheets. Make sure to print legibly. For vaccinations, you may be filling syringes with appropriate vaccine doses and tracking lot numbers. Once you have administered vaccine, you may need to direct the client to the observation area. Otherwise, direct the client to the Q&A section near the end. Remember, the purpose of a pod is to get as many people the necessary medication or vaccine as quickly as possible. Again, your job is threefold. 1. Dispense the medications according to what is indicated for each person on the medical form. 2. Tear off the label and affix to the form or handwrite the lot number for each person receiving medications. 3. And finally, write the client's name on the medicine bottle or box as well as the associated handouts or information sheets. Always practice universal precautions when giving medicines or vaccines. Be sure to keep the medical forms at your station until they can be collected. Most likely there will be a radio assigned to the dispensing area, and you will be given instructions on how to use it. If you get low on supplies or have any other issues or problems, notify a supervisor. If at any point you feel a client is having any medical or mental difficulties, you can ask someone to escort them to the acute care center for further evaluation. As a member of the dispensing team, you play an important role in the overall pod operation. Remember that you will be giving people potentially life-saving medications and/or vaccinations. Please be polite and professional when speaking with clients and staff. Remember, too, that a public health emergency can be stressful, and some people may have a hard time coping with their anxiety or fear. Speak to them in a calm and soothing voice and offer to get them assistance if needed. Always ask the client if there are any questions you can answer. Mental health professionals and translators may be available if needed. If you encounter any issues or problems, please notify a supervisor or ask for assistance from a member of the safety or security team. Thank you for your time and attention. You will now report to the dispensing area for some further instructions.